The gynecologic procedures on surgical chloe will be performed on interchangeable uterine assemblies. Here's an example of the normal uterus, called uterine assembly number 1. The normal uterus has an ectopic pregnancy. It has a normal sized uterus. It also has a blood supply into the uterine cavity so that a vaginal hemorrhage can be documented in a scenario such as the von Willebrand's disease scenario. So the vision of this particular uterine assembly is that the learners could first do a vaginal hemorrhage scenario, then they could do an ectopic pregnancy scenario, and then they could do a hysterectomy scenario. And if they wanted to, they could injure the bladder and then they could repair the bladder. You'll notice that this assembly has a blood supply here and here, as well as here and here. So this simulates the normal uterine blood supply in a fashion such that the learners can ligate a vessel, they can tie a knot on the vessel, and if their knot is not secure, it will continue to bleed. Uterine assembly number 2 includes an enlarged uterus. You notice this is bigger than uterine assembly number 1. It has a larger cavity inside. So uterine assembly number 2 can have products of conception placed up inside its cavity so that the learners can perform a suction curettage of the uterus. This uterine assembly also has an ectopic pregnancy. You'll notice also it has an immature teratoma, also called a dermoid. So this immature teratoma can be removed just like a real immature teratoma. If the learners cut into it, it'll make a gooey mess just like happens in an operating room with a real patient. So the vision of this particular assembly is that first the learners can do a suction curettage of the uterus. Then the learners can do an ectopic pregnancy. Then the learners can remove the dermoid. Then the learners can do a hysterectomy. Maybe it's going to be an abdominal hysterectomy. Maybe it's going to be a vaginal hysterectomy with morcellation. In this fashion, at least 4 uses from this one uterine assembly should occur. Uterine assembly number 3 is the fibroid uterus. If you'll take a look, you'll notice a fibroid here. Now this is an example of an assembly in which one would need to maximize the planning purposes in order to use the assembly as many times as possible. Obviously you can't do your hysterectomy first if you wanted to teach your residents how to do a myomectomy. So you do your myomectomy first, then you might do some of the other procedures that are available. This assembly has a normal functioning cyst, so you could do some procedure on a normal cyst. This assembly also has an endometrioma, so you could have your residents, medical students, or other learners resect an endometrioma. Finally, after you've done your 3 procedures, then here again you could do a hysterectomy, such as a vaginal hysterectomy with morcellation or an abdominal hysterectomy. This part is called the abdominal wall. This is the laparotomy abdominal wall. Within the laparotomy abdominal wall is the abdominal insert, which is the part that's actually going to be cut during a laparotomy. Let's take a look at the abdominal insert. It's got simulated skin, which is thick enough for you to reclose and reuse, just like the rest of this part. The subcutaneous tissue has blood embedded in it. So this fake blood looks very real. When the learners make their incision and they see the blood at the end of their scalpel blade, that helps them suspend their disbelief. It helps them act like they would act in a real operating room. Under the subcutaneous tissue, of course, is the fascia. This fascia is designed so that a realistic fan and steel incision can be made. Of course, you've got rectus bellies. They're separated just like rectus bellies in a real surgical case. And underneath that's the peritoneum, which of course has to be carefully entered so that any intraperitoneal contents are not injured. This part is the laparoscopy abdominal wall. You'll notice the pre-drilled ports. Now, of course, if you wanted to teach your learners how to do trocar insertion, you'd go back to this other abdominal wall and you'd use your abdominal insert to insert the trocars. But if your education for that day is confined to something such as, say, let's resect an ectopic pregnancy, the pre-drilled ports are here. You could insert your trocars through the pre-drilled ports and go through that